starting our session today, what I'm going to do is briefly divide the session into certain steps for you, which will include your USMLE steps, the decision of USMLE itself, how we go about the personal statements, the interviews, and finally, we'll have an overview about certain things about what I am currently doing in my journey, how you can feel confident about where you are at whatever stage in life you are. And at all times, feel free to ask any questions in the chat box, and we'll have an interactive session towards the end. Perfect. So let's start by asking, what is brain? And I think everyone is allowed to have their own definitions, not from a scientific point of view, but this is from one of the magazines I wrote along with my team. And this is how I think a lot of us can comprehend it. Brain is an internal cosmos within our skulls with windows to the world. So there's philosophy, the master of illusion that is life around us, the brain, an organ of destiny. It is much more than just the neurons that make it. Brain is a muscle that can move the world. And that, my friends, is the expanse of neurology. So I think almost every little thing in the world comes down to how your brain perceives it. And I think that's enough motivation for people who were confused about neurology. So let's move ahead with the session. That is how we are going to divide the session. I'm going to briefly take up all these topics, but at any time, if you feel something has been left off or you have a very specific question, please ask it in the chat box. So starting with the USMLE itself. Neurology itself is a decision. It's a major decision because you're going to spend a lot of life, a lot of time, a lot of sacrifices are going to be made towards neurology. But like any other thing in the world, if you love it, I think the sacrifices are worth it. But another decision that goes along with neurology, specifically for this session, is if we want to go ahead with USMLE. So USMLE is the only legit way that you can enter the US system and a lot of other countries as a neurologist, as any other specific doctor. But the decision becomes very difficult because it asks for a lot of investment, both time, money, and mental health, I would say. So you need to be really sure if this is what you want. Let's now stick just to neurology. How neurology happened to me as a decision might be a good example for a lot of you, but no way is the end of all the possibilities. For me, I was inclined towards neurology since an incident that happened in my family. My grandmother was diagnosed with Parkinson's, and wrongfully so. After 6 months, it was realized that she had a pineal gland tumor. And that was a moment I realized there's such gap between the diagnosis and treatments, especially in developing countries. But when I explored more about it, I realized neurology was such a beautiful amalgamation of education, research, and being a clinician. For me, those three things were really important. And hence the decision became pretty much clear that there is this country which offers an equal chance to neurology, an equal chance to any international medical graduate to come compete with them, outperform their students, and become what you want to become, right? So please factor in all of that. That in no way means that USMLE is better than any other alternative, be it PLAB or an Indian PG or wherever in the world you are. There is a different set of proportions, permutations, and combinations of pros and cons that every place offers you. US offers you the possibility of pursuing neurology as a specialty directly. US offers you a lot of possibilities to fulfilling your ambition, but doesn't necessarily offer you the best kind of life. Now, how you define life depends upon how you perceive life. For someone, doing household chores might be a huge thing. US is definitely a difficult option compared to India with respect to that. But for someone, the fact that they're able to pursue the recent most advancements in their field might be the biggest pro. So you will probably get that in a developed country. So make sure what your combination of pros and cons are. PLAB offers the most beautiful life for someone who's willing to have that life. I like to think of PLAB as a beautiful system that makes everyone uniform, because they have a beautiful NHS system under the government, which is not the case in US. Similarly, in India, I believe surgery has such potential because you have so many patients, which becomes a harder deal in US. So make sure what works for you, and then you are ready to invest everything, time, money, and your mental health into it. So that covers the first two parts, the USMLE and the decision. Let's move on to certain steps. As we all know, we have steps 1, 2, and 3, which have to be done before you are officially licensed as a US doctor. Steps 1 and 2 are necessary for getting into the residency program, and 3 needs to be done before you end your residency program, right? So I am hoping everyone knows about certain steps, and there's a video that I would love to share if you need more information about step 1 in specific. But if you've heard certain things about steps, I had certain realizations that I jotted down, and I would love to share it with you guys. So something about the step 1 is that recently it has been changed into a pass or fail system, and which has a lot of communication associated with it, misunderstandings associated with it. Step 1 is definitely one of the most beautiful, toughest, longest exams in the world that you would ever give. But if you've chosen you want to do this, it would be the most satisfying experience you would ever have in your life. Sitting for an 8-hour exam is not easy, but if you worked hard, you're being asked the right questions, your knowledge, your hard work is being challenged the right way, and it gives you scores that very much authenticate your performance. It is such a beautiful experience. But now, being pass and fail, a lot of people have started thinking that we might not need to prepare enough for it, which is not the case, because steps 2 and 3 are the steps which happen after step 1. They will build up on your knowledge of step 1. So there is no way, if you underperform on step 1 and still pass, you will be able to replicate a better performance on step 2 and step 3. So very highly advisable. Please take your step 1 seriously, enhance your knowledge, enjoy the process, but at the end of the day, make sure that you expect what you perform on step 1, similar things to happen on step 2 and step 3, because now, as international medical graduates, your scores on step 2 are going to be the only objective parameter to get into a competitive program. So now moving on to step 2, I think I tried to put a few misconceptions that people have in a way. This is a screenshot from my LinkedIn, but I think these are things that need to be understood very importantly, because things have changed rapidly in the past 5 years. So I gave my step 2 last this March actually, so it's not been a lot of time, so I hope my information is not out of date as much. So misconception 1 is that step 1 is all that matters. Not really, and especially not anymore. Step 2 is the only objective parameter as told. However, steps are just one important aspect of a huge puzzle. Please understand, at the same time, I do tell you that steps and scores are important, but that is not the only thing. You can't remove your focus from everything else and just focus on the scores. Once you're selected for the interview, your scores are equivalent to anyone else. Now, the program director wants to look at your personality. He wants to choose if you are a fit for the program, if you want to be his family for the next 4 years. That is sadly not how it functions in all parts of the country. It's not just one exam and then you get into the program depending on your rank. It's those scores that help you get the interview, and the interview decides what kind of a person you are, right? Number 2, giving step 2 is much more easier since you are used to giving 8-hour long exams after step 1. So giving steps never really gets easier. Your expectations now might be closer to the truth, but step 2 is still challenging. So take it not for granted. So it's a 9-hour exam or long exam, step 2, and step 3 is similarly a 16-hour long exam, which sounds scary. But trust me, if you take things one at a time, one step at a time, they are just fine. But do the justice that these exams ask you, require you from. It's important to also mention these are exams that if one scored, you will never get practically an opportunity to change your scores. So you've got one shot, and I think it's a beautiful blessing in a way. Your life is too far precious to give these exams again and again. So just give it your best shot once and for all, and I'm sure that your self-assessments will predict a good score for you, and you'll take this exam when you're ready for it. Okay, I think one very common question that a lot of people have: why do you even have a lot of steps? Why don't you just take one step together as a 2-day single exam? Will help us with a lot of issues and troubles. But you need to understand the psyche of this exam. The people, once you go to US, will not ask you about how you perform or what is your knowledge on neurology, because these exams are so accurate. Whatever your scores are, they are written in stone that, okay, this is your, unfortunately, your IQ levels surrogate for them, because you might have had a bad day, but they will not ask you what was the reason for your scores. Those scores will have a true reflection in their heads of what they want to have, what they're okay with, and what they're not okay with. So steps 1 and 2 are entirely different skills. Step 2 is called a clinical knowledge exam, whereas step 1 is a basic sciences exam. How good you are with the basic knowledge and how appropriately suited as a clinician you are, respectively, for both the exams. So, like, if I imagine myself thinking about these exams, it wasn't easy. It wasn't like, oh, I love these exams, and so it doesn't make things harder for me. But you have to understand the true purpose of those exams. Help the knowledge help you later in life. Help the knowledge tell you why it is not irritating that there are so similar choices. There's a reason there's similar choices, because you will get similar situations in life. So next best option is a thing. So that is my fourth misconception. Multiple choices are correct in step 2 questions, which makes no sense. Similar to real life situations, you will really be confused among options that make sense and how they are all somewhat correct. With the single best choice is decided, since there's a reason why every other choice isn't the next best step. So I think this challenges your brain in ways that are much more realistic in situations. What would you do, an MRI before or a CT scan before? Even though both will show you similar results for a situation, there will be factors like time. If there's a head trauma, the next best thing to do is a non-contrast CT scan. The reason is time in this case. And you have to accept that things with time will change. Technology will evolve. And if hypothetically we had an MRI scan that would do the same in the same amount of time, that could have been the next best option. So medicine is a very evolving subject. You need to study it in that way. So I think most things done about step 2. Moving on, step 3, I won't talk a lot about it because it's not a mandate that you give it before. But as an IMG, I would definitely say, if there's this possibility, please go ahead with step 3. Because that just elevates your chances in the sense that you're a dedicated person. It helps you save a lot of time during your residency program, because that does not give a lot of time. And importantly, a lot of step 3 is both step 1 and step 2. So the closer they are for your journey, the better it is. But again, everyone's journey is their own journey. This is one important lesson I would want everyone to take away. I know a lot of people freak out thinking, oh, my senior has done this, I'm so late in my journey, or I'm not reading this book, oh, I don't like first aid, I haven't done this resource, and it overwhelms you. The beauty of USMLE is that it is your own journey. There is no direct competition. And trust me on this when I tell you, there is no one correct way. There is a huge possibility and every practical way that you can give your step 2 before your step 1. That the only problem is that will not make sense to a lot of people because you do things sequentially. But that does not outrule a person who wants to do that. Similarly, how you plan your clinical experiences, your visa process, your steps can be a very different situation for everyone, because we are in a country which is not our homeland. We are trying to go to US, which will require visa issues, which will require us to prove that we are better than their students for them to consider, which might sound unfair, but it makes sense in a way that you are able to achieve your dream if you work hard enough, which I think is good enough for this world. The third point is that if you meet people who, in whatever way, demotivate you, intentionally or unintentionally, I would rather advise to stay away from them, because I don't believe, frankly, however difficult this task may be, it is not impossible. Even if someone asks me, is it possible to get a neurosurgery in US? I never say it's impossible, because people do get it. It's difficult, but people do get it. If you want it enough, you will get it, right? So it's all about what you want and how much you want it. Neurology, thankfully and frankly, isn't that competitive when compared to dermatology and a lot of other things. It's decently competitive, but again, the concern should not be how competitive something is. It should be how badly you want it. So that is one tip that I want to give everyone. Moving on, there is something that I've sprinkled throughout my presentation, and I want to tell, because I love telling how people can know what they're supposed to know with the knowledge they already have, without putting you under burden of more books and stuff. There's just a way that things can be studied, and neurology is beautiful because it's super logical. So I'll just tell you how I think about the brain and how I do think about neurons. And I'm sure if a lot of people do know about it, but I'm just trying to offer you another perspective. So everything that is neurological, everything that is what we are going to deal with, be it nerves, be it brains, be it spinal cord, everything is either gray matter or white matter. How these terms came about was when we grossly dissected these specimens when we had no way of knowing what's inside, and they just seemed gray and white. Later, we realized that the gray matter is actually the collection of cell bodies, and the white matter is a collection of myelin or the axonal fibers, which makes sense. But our problem is at a point we stop asking ourselves questions. A few of us do have the answer to why does it seem gray and why does it seem white, to which the answer is white because fat is whitish, creamish, and myelin is fat, and myelinated axons appear white. A lot of us know these answers because these are easier to comprehend, but then there is a lot of times we don't ask ourselves questions because medical system just makes us used to cramming things, which I think neurology offers a lot of relief with, only if you ask the right questions. So for example, in this diagram, I'm sure hopefully everyone can see this thing that I'm pointing towards is the caudate. Then there is putamen, and then in between there is the collection of white fibers, which is called the internal capsule. So internal capsule is nothing but a collection of axons that is condensed from everything that is coming from the cortex. When you go out of the lentiform nucleus, you get something called the external capsule. When you go out of it, you get something called the colostrum. When you go out of it, you get something called the extreme capsule. And when you go even outer, you get something called the insula. There is so many terms that I just said, and it can be overwhelming for a lot of people, especially who are people who are not really interested or are uh, wrongfully afraid of neurology. But at the heart of it, if you understand why and how can I even differentiate these two things from each other when I grossly observe them, it is because one thing has to be a gray matter and the other thing has to be a white matter. Because if it wasn't, they would just be one single gray matter, right? So the capsules are white matters. They're nothing but fibers. They're called internal capsules because it's on the internal side, and the external capsule is on the external side. And there will always be a sequence of gray, white, gray, white, gray, white. And that is how simply logical the brain is. And if you think about it, there could be no other way. And the only reason we have these names are because humans gave these structures these names, right? So again, not going in a lot of details, but I hope that offers a certain perspective to how beautiful neurology is. And this same pattern goes on repeating itself the more you explore neurology. Okay, so taking off some of the academic session for some other time. Okay, this is a beautiful thing that I happen to be lucky enough to be able to do with my team. I love creating riddles and I love neurology. So the only way I could connect to those two worlds was to challenge myself and make certain riddles to have more people inclined towards neurology. So I would love you guys to answer the questions in the chat box until I show you the answer. But I'm going to tell you this riddle and you need to answer to what it is indicating. And there are a lot of hints there. Like in a single riddle, you'll find 10 different hints. So feel free to write as many reasons for you to come to that answer. And I hope that you'll enjoy this. So here it goes. Nature found at places in a state they shouldn't, rubbed the skin of the shark, burnt the leaves of the forest, the potatoes too hard, and beneath your nails, a proliferation of fibroblasts. The gatekeeper that kept me from going berserk is dead on 9 or 16. If you have me, I sure shall come out. I might, how I might, keep guessing. So depending upon if you're in a first prof, second prof, you might have not heard about it, but I'm sure you've heard the name of it. And trust me, in those 7 lines, I gave you 10 to 12 hints. And the reason that I created this was for you to have fun and also educate yourself at the same time. So let's see what that, I hope that Akshata, people are answering something in the chat box. If at all, I can see the chat box right now. Akshata, I'm audible. Can you unmute yourself?
Yes, sir. I guess we have
We have a
guess.
few answers.
Yeah,
Oh,
tubercular sclerosis. Aditya Shah says tubercular sclerosis.
Perfect. So lesson number one, never stop participating. So kudos, Aditya. Good job. And, and there's another riddle that I'll just sprinkle because I have both the answers together. Everyone, please try this. I am sure most of you might know this. Caged in your own body, aggression, depression all at once. The striatum is sick, the inhibitions too weak, the dance too deadly, the dad, the death bringer, the descent too dominant. So again, in those four lines, I gave you 10 to 12 hints. And if it's absolutely fine if you don't understand them all. The reason that I'm giving you those hints is because even if you know the answer, you will be able to learn so much more at the end of it, right? So let's move on to the answers. And
We
the
have
answer to the
quite a few
second
guesses.
part was Huntington's. And I think, Akshata, I think a lot more people answered this time, I hope.
Yeah, yes, sir.
So I think we're doing a good job. We're doing just a fine job.
Yeah.
Okay, so everyone who answered and everyone who didn't, I want you to understand something. There were 4, 5 lines there, and there was so much that you could get it from. The first word, caged, the CAG trinucleotide repeat expansion codes for glutamine, and that is what expands in Huntington's disease. There's the rapid onset neuropsychiatric symptoms, hence the aggression and the depression. The striatum is the caudate nucleus, which degenerates in this disease. The extrapyramidal inhibitory pathway is compromised, hence the inhibitions were too weak. The dance is deadly, which is chorea in English. The genetic anticipation during paternal inheritance. The death bringer, the dad, meant that every time this disease is passed on from your paternal side, from your dad, is when this disease manifests and even amplifies, which is called the concept of genetic anticipation. And there's the last word was dominant, which referred to autosomal dominant inheritance. So in no way I want to overwhelm you all, but in every way I want to fascinate all of you that words can be used so beautifully to teach, to intrigue, to educate. And I hope that if all of you did find this interesting, please mention in the chat box. That would definitely motivate me, my team, the GNA team, everyone, and you yourself, right? And to the first answer, which was correctly mentioned by Aditya, tuberous sclerosis is the answer, which I would just want to briefly educate everyone about. It's a condition where there are different tumors that happen inside your bodies called hamartomas. Hamartomas is a growth of any cell line which does not originally belong to that body organ. When that is happening all across your body, that's one reason is tuberous sclerosis. Tubers mean potato. Sclerosis is hardening. There are certain things you see on your body called Sjagren's patches or ash leaf macules. All of that were the hints that were given inside. But how it relates to neurology is because the commonest reason for deaths and seizures is in tuberous sclerosis is seizures, because there are again rhabdomyomas and hematomas that happen within the brain called sega. I don't want to go into too many details, but point being, if you understand and allow yourself to be fascinated by the right things, there is so much that you'll find. I remember there used to be just one paragraph on tuberous sclerosis 30 years from now, because I was given a book by attending in US, and I did present a presentation on it, and it just makes us realize that whatever we know today has come at the hard work of so many people before us, right? So you as neurologists are going to be able to do that to so many future neurologists. So moving on, this was one quiz that I did conduct for a magazine that I did, which was called Synapsia. So all of these questions I created for different sub themes within neurology. And this slide is just to tell everyone that how neurology is not just one subject. From neurohistology, immunology, pathology, microbiology, ophthalmology, otology, neuroimaging, you can be the master of everything if you have this love for neurology. And each of these questions, we don't have a lot of time, but was meant to teach everyone not that how something is such a cool question, but how even if you don't know the correct answer, you can reach to the right answer. So every little question will teach you something over within this whole thing, right? So let me just take one example, because I I I really want everyone to take something from here. All right. So let's focus on the 13th question, which is neuro ophthalmology. Which of the following cells in the retina and visual pathway do not create an action potential? So optic tract neurons, rods, dendritic cells, bipolar neurons. Okay. So I'll tell you how I expect anyone to approach this question. Anyone, I can expect to know that, oh, these are things within the retina, but which one was which, I don't even remember. I studied in my first year. What do I do about it? I will rather leave this question and not get a negative mark. It's okay. But that is what I'm going to tell you, how the one who scores the best trusts themselves without knowing anything. So action potential will be created in any neuron of the body. That is how neurons function, right? So optic tract neurons are neurons, bipolar neurons are neurons, dendritic cells are kind of neurons. So all of them are supposed to create action potentials. Rods are the first cell that are encounter light and convert that light energy to electrical energy. And I'm sure everyone here knows that rods are receptors for light, right? When a receptor receives an energy in a different form and converts into electricity, that isn't called an action potential, that is called a receptor potential. So even if you knew whatever you knew and formulated them in a way that could help you make an educated guess, you would know the correct answer is rods. Again, I wanted every question out of here to teach you something, both academically and how you take tests, right? Similarly, if you go to neuromicrobiology, which is the 15th question over there, which of the following is not a protozoan that can infect the brain? Even if you know nothing about it, everything is a confusion. You don't remember your microbiome. Let me just tell you how you can go about it. You at least know that a protozoan should mean a single-celled organism. Toxoplasma, I don't know what it is. Trypanosoma brucei, I don't know what it is. Naegleria fowleri, I don't know what it is. Although I'm expecting that in your final years, all of you know it. No way saying that don't know it. But I know that tinea are tapeworms. Tapeworms are visible organisms. They are multicellular. So even if I don't know anything about the brain or anything else, I know that this cannot be a protozoan because this is something multicellular. So my answer is C for sure. Now, how I go about it, I click C, I get my marks, I score well in my exam, I go home and then I read about it, right? So know that in this age, education is not everything. Studying smartly is as much important. And then when you are at a stage where you can elevate education and give back to society in whatever way, that would be the most beautiful thing. But test taking strategies are super important, right? Okay, so this is a poem that I would want to share, but towards the end, before that, I want to share certain things. So I will stop sharing my screen for a while, and I would love if certain people who are enjoying this session can turn on their video cameras, because I would by then try talk about certain topics that we've missed. Okay, so Akshita, do we have any questions
Uh,
in the chat box as of yet? No, right?
no, sir, it's just compliments.
Great. I think we can do with compliments. We don't mind compliments, right? Thank you. So, okay, let me do justice to my session, which has been rightly titled "A Journey to USMLE" for towards neurology. So, I talked about steps. Another important thing is your clinical experience. Although there is this possibility of getting telerotations right now because of the COVID situation, I would still say, in whatever possibility way you can manage to get a hands-on clinical experience in US, be it an externship, be it a clerkship, less fully so if an observership, but still shows dedication that you've been to US, that greatly increases your chances. So getting rotations isn't difficult if you look at it in a way. It isn't easy if you look at it from another way. The right way technically was always supposed to mail a lot of universities, send them your step scores, which you don't have after step one anymore. So things have become difficult. COVID has become a barrier. But then there are a lot of third party organizations which offer paid rotations. Choose for yourself, but let me just tell you, it's not a red flag if you're doing a paid rotation. What you want from it at the end of the day is experience in US, both in the form of a letter of recommendation, which is personalized for you, and importantly for you to go to US and understand how things work, if this system works super well for you. I happened to go to US last about 2 months ago. I spent 4 months in US, in Chicago and New York, and I did only neurology rotations because I was sure that is what I want to do. And all of my rotations were so diversely different. One was an inpatient department where I went for a stroke code for a week. I did a neuro ICU. I did 2 weeks of neurology consults with attendings, and I understood how culture works there, how my personality fits so well, and how things I wanted in my life worked so much better there. And that can be a huge confidence booster for you to work better towards your dream, right? uh, very little things like they will, if you like, there were things I knew, and I used to tell my 60-70-year-old attending, sir, if this is a possibility, could this be the scene? And they were so okay saying that, I don't know, let's check it on the net together, which doesn't happen in a lot of places. So that culture of not knowing anything and being okay with is so liberating, which I think sometimes, like, I've had the experience, which can be a little intimidating in India because there's a hierarchy, which isn't the case in US. Again, things like, if you need to convey something to your junior, they take you to a separate room so that you don't feel insulted in front of anyone, which isn't even thought of in a lot of places. So things like this aren't generalized to a system or a country, but you will find people like these in different areas of the country, more so in US than in India. And my point being, you need to assimilate things that help you feel good, and how you would like to be treated, that is how you need to treat other people. Similarly, the patient interaction, the greetings to the patient are a huge thing in US. The ability to type, operating an electronic medical record system, is huge in US. Goes unsaid. The ability to be confident in speaking your English. The accent can be anything, that will grow with time, but you need to be confident that that won't be a barrier for you, is super important. If it is, build onto that. So things like that play a huge role, which were nothing sorts of medical academic things, right? Because once you are in the program, they know they have to teach you. All you need to be is teachable. That is super important. So that is why a clinical elective is super important. Both an inpatient, outpatient, try a few different cities, because that helps you build the confidence of traveling. uh, I am assuming some people, me being the only child, a lot of people had the concern, because you have to wash your own clothes, you have to prepare your own food, and you have to do a lot of stuff. I had never had an issue with traveling because I love traveling. I'm a little, I think, dangerously confident with traveling. So please be cautious when you go to dangerous places. But point being, even if we have all those obstacles, the reward that you're getting in the kind of work satisfaction you get at a place will be worth it. Everything in life is going to be a compromise, in terms of something is going to be beautiful, something is going to be hard at the same place, right? But you need to prioritize what you want in life and work those bits out. Nothing feels undoable, be it washing your own clothes, be it preparing your own food. You will learn it. Just don't deny yourself an opportunity because of things like that. Your work is one thing that will never give you or backstab you at any point in your life. Your degree, your profession is going to stay with you no matter which person does or person does not, right? So give it your all, and go in a direction what you want to do in life. Aditya, I will go through all the questions together after a few things that I need to mention, but please go ahead and write your questions at all times, right? So I think that's something about the clinical experience in US, which are very varied depending on which place you go. There are certain people who apply to neurology as a backup. Uh, I would say it is okay, but I would not advise it, because if you're sure about neurology, I think go ahead with neurology, because it reflects in your CV, your personal statement, that you're keeping both doors open. And people in neurology have only one major criteria, that you need to be all in for neurology. You need to be someone who loves neurology. You cannot have neurology in US thinking, let's see if I like it, or if I don't like it, I will make do. It's going to make your life miserable, and it's going to make their life miserable, right? So the same goes to every specialty in US. The next thing I come to is your CV building. Coming from the same topic, your CV needs to scream what you want in life, which can be in very different ways. If I'm applying for neurology, my CV in different ways has to scream neurology. That they don't have to ask me the question, are you interested in neurology? Because that that is not what anyone wants in life. That is how developed countries operate, right? So if there was my third year when I realized that, oh, neurology, it is for me. And then I made sure all my research projects, I started targeting it towards neurology, be it a research presentation on circadian rhythm disorders. I found a way to connect it to neurology. Be it a magazine that I created as an editor with my team. That magazine, the only condition, I decided to give 12 hours a day to creating that national magazine, to create national quizzes, was because they were all neurology. And that was something that I did not feel exhausted with. I wanted people to see neurology how I see it. And then, be it other experiences like in professional organizations at different positions, opportunities will fly in front of you. You will never have a reason to say that you didn't get an opportunity. You need to keep your eyes open, and importantly, make notes of everything you do. I started my journey dedicatedly in my third year. uh, I'm sure you guys are younger, you can do it earlier, you are smarter for sure in your own little ways. But you need to connect your passions to your works, to what you want in life. So my CV did have this thing that, oh, I've been the editor of a neurology national magazine, which is out there. My links were in my CV, my personal statement. So there's proof. The moment you want to take it out, you can check it out. My YouTube channel showcases neurology psychiatry videos. My researchers scream neurology. The fact that I've attended international neurology conferences is a reflection towards my interest in neurology. So no one's going to ask you that, but in certain ways it needs to be shown that you are passionate towards what you're applying. Same thing goes for surgery, same thing goes for dermatology. And trust me, it does not need to be in a way that, oh, you have not made a magazine, or you do not have a YouTube channel. There is something that you have. Showcase it and connect it to your passion, right? Whatever it might be. To give you an example, I loved writing poetry, and I still do love writing poetry. And there was this time I realized, if I love poetry that much and I love neurology that much, let me challenge myself by connecting it to each other. And there was this poem that I happened to write recently on autism, and that was my personal passion. And I found a way to connect it to neurology. I would share it with you guys towards the end of it, because that has very personal significance to me, in the sense that uh, in my own personal statement is where I put that poem, because I felt that confident about it. And if you ask anyone, personal statements are a huge thing which decide if you do get into a program or not. So it's not recommended that you extend the limit of that personal statement beyond one page. But again, like I said in the beginning, there's no one correct way to do things. You will be offered lakhs rupees to pay to for someone to write your personal statement, for someone to fill in your CV. But guys, understand, your personal statement, your CV has to be personalized. No one can know you better than you do. So start introspecting, start writing down notes if you think you will need what you've done in your life. I was someone who used to print every certificate I get, because I have a collection that way. And I think that record keeping helped me a lot. So if you start looking what you've done a lot more than that is required. You will have to filter out things you don't want to put in your CV, but make notes, be organized about it, know what you want in life, right? So that was about the personal statement, clinical experience, USMLE steps 1, 2, 3, and overall picture about USMLE. There are two things that I want to do before I start taking the questions and answers. uh, One is, or I think we can do the questions and answers before, but I have this condition that whoever is asking these questions will have to turn on their video and ask me their question, because that is a better way I can connect with you guys. Akshata, does that sound fine?
Yes, sir.
Perfect. So do we have, I think Maneet is the first question here we have.
Uh,
Uh,
yes, sir.
I'm sorry, I can't turn on the camera right now because it's 3:30 in the morning.
Okay, Maneet, you can
It's big.
ask the
Yeah,
question directly on over the audio.
yeah. Thank you. So actually, I'm pursuing my MPH right now. I'm in my second semester. So I'm through the USMLE journey. I'm done with my step one, but I didn't want my CV to go blank. I just don't want to show up that I'm just preparing for my steps. I don't want it to be blank. I was figuring out multiple options, and then I understood the part that public health will give me a perspective of the base or how the United Health System works. So that's the reason I came up with. And after coming here, this started, this doubt of, will actually MPH 8 anything in my USMLE journey, or does
Okay.
anyone do
Let
that
me
before actually going to USMLE? This question started to mingle in my mind. So I just
let
wanted
me
to ask.
try let me try answer that for you in a way that will answer you specifically, as well as give you a perspective about how US programs visualize the things you have in your CV. All right. So MPH is basically a program in public health that a lot of people do consider before coming to US for multiple reasons, because that adds to your CV that you've done something which is relevant in US, and at the same time fills in your gap if you do have a gap. Frankly, like any other thing in your CV, nothing is compulsory, nothing is mandatory, can go the right way, can go the wrong way, but you have to justify your passion towards it. They will know if you've done it just to show that you're not interested in it and you've done just to fill in the gap, because there will be other candidates with other things. But if you're passionate towards it, and if your intent is genuinely that you want to understand how the system works, then that will be on you how to make it a plus plus. It will be a plus plus for sure. But again, if I tell you if it is mandatory, absolutely not. You can still fill in your gap year with other things. If you're doing it in your home country, obviously it shows a little lesser dedication, that you were still in your home country, but you were still doing something. You have to take a very personal call, in the sense, if you look at your CV and you feel, oh, my gap feels justified, or my CV feels good to me, I can talk about it with all the confidence in the world in front of anyone. That is the final question you need to ask yourself, for which MPH can be a good option, for which MPH can be a neutral option, for if obviously you are not going to come across as someone who just did MPH just for the sake of it. But if someone does, that will come even as a negative option. And at the same time, you need to consider the time that you're giving to whatever you are, which is step 2 or electives. You're taking off that time and giving it to MPH, right? So all of those factors need to be taken into account. But no one thing is a make or break deal. If at all something is for sure, the maximum input needs to be given to your step scores, and then your CV as a whole, which will include your MPH thing if you've done it, right? So I hope that answers your question.
Actually, yeah. Thank you so much.
All the best.
Thank
Okay,
you.
do we have Krupa next?
Yes, hello. Thank you. You have been very, very, very inspiring. So yeah. Okay, my question is, I am from India and I have given my step 1 and I'm preparing for step 2. But
Mhm.
I have gap in my year of graduation and by the time I'll apply. So
Mhm.
will it be a red flag for when I apply to neuro? Because I really love neuro.
Okay, so I am applying for neurology and I have completed my year of graduation. I did my 2 of my electives were externships. That means they were after my graduation. All right. Frankly, doesn't really matter a lot, because as long as I'm showing, for them everything is US clinical experience, and externship means hands-on. So I've been to US, I have done work, and I can talk about it with all the confidence. So 90% of what anything else would offer is covered in that. Year of graduation does make a difference if it is too far away, if it's like 2 or 3 years ago, right? Not a year or a year and a half basis does not make a lot of difference. So that should not be huge on your head, or you shouldn't feel underconfident about it. I was someone who wanted to give his steps in internship because I loved doing my enjoying my college, and at the same time understanding the concepts that I made in my final year, and then study for my steps. That is how I operated. So if someone operates in a way that they're okay to giving it in third year, that is good enough for them, well enough. But this should not be a bigger concern, because I think now there has been a limit in our colleges to what time we can extend our internships, which was the case in my case. And I frankly did not feel that. I mean, you have to go by the way, okay, these are my best options, and then I have to be confident about it. If you do have an option to extend it unlimitedly, for sure, go ahead, because your year of graduation can be a little later. If not, doesn't make a huge lot of difference. So should not be an issue. All the best, Krupa. Okay. Do we have Aditya? Aditya, you're muted.
Hi,
Hi,
am I
Aditya.
audible?
Yep, you're perfectly audible.
Thank you so much for this inspiring session. Also. So my question is, now in this academic year especially, there are many universities that are not accepting international students like us. I'm from India, so I'm facing a lot of difficulties in getting a university-based neurology rotation specifically.
Yeah.
So, and recently I had one university-based elective, but our college has an affiliation with that university. But due to some administrative reasons, it got cancelled last, even though I had confirmation for it.
Okay.
So I had to hastily look for some other rotation.
Okay.
So what my question is, how do I stand apart? How do I stand apart from those who have done or who will be doing university based? If I'm doing
Oh,
a clinic based or a hospital based
okay.
rotation.
Let me try answer that question to you and everyone else in a way so that it gives you an idea about how US system works, how program directors work. Okay. So it would have been amazing if you would have gotten a university based program, because more so not just the LOR, because sometimes the LOR is very generic in university based programs, which becomes even a negative. You don't want a generic LOR, you want a personalized LOR, even if it is from a clinic. You want someone who's worked with it. So first point, you can start thinking of it as a positive as well. Obviously that's kind of justifying what we have and what we not, but secondly, there are still a lot of places where you could try mail and get a program, but if I tell you honestly, it isn't easy. It is very, very improbable getting it at such a short notice. But the important thing about it is, uh, if you are able to express that you've done your hands-on clinical experience at a lot of other places, which might be paid, it's okay. People know that is paid because that is the only way you're getting it these days. But that shouldn't stop you from looking for university-based programs. It will, if you can show that you've had your hands on a clinical experience and you know stuff, you've managed like I did a paid thing, but it was by chance one of those rotations. I managed the whole clinic on my own, and I did the EMR, I greeted patients, and patients came to me and they were like, for how many years have you been working here? And that instilled in me a confidence so much when I was like, I have been working here for the last 5 days. So it felt like it's all relative. I can sell myself more than someone who's done a university rotation just by talking better in an interview, right? It does make a difference sometimes, because if you have a university based LOR, that university might give you an interview. But in all honesty, let me tell you, whatever you might do, if you are an IMG, you require a visa. So 70-60% universities who do not want an IMG will, irrespective, never have you. They will never have you, right? Because that is something we can't control. But those 10-20% will always send you. And if you are good in other things, be it a university based program or other things in your CV or things you've done or your step scores, those 10-20% which choose among IMGs will definitely have you. So frankly, you are not losing out on a lot of options, right? All you need to know is that, okay, yes, I don't have a university based programs, let me shine through other things which are equal weightage. like like there is no mandate to have a YouTube channel, there is no mandate to have a teaching experience, there is no mandate to similarly do a university based clinical experience. But whatever way you go out of the way and you reflect it in your CV, it shows in a way that, and that creating your CV is also a very beautiful experience because you have very limited words. So I used to put my links there. Like if I've done a magazine, I used to put a link on that page. Here's my article, here's my riddles, here's my channel, here's how I do things. And at the end, because you can't compare, right? Having a YouTube channel cannot be compared to going to a university based program, but that is the best you can do, right? So shine in ways you can yourself. But the positive note at the end of it, if you're even missing out, you're not missing out on a lot of things if you make up through other things. But going to US for a clinical experience, doing hands-on things whatever way you can, is a very huge factor. So make sure you do that.
Okay. Thank you so much.
All the best.
Thank you.
Okay, Gayatri, do we have you? Hi, Gayatri.
Informative session, although I did miss a few details in the
You are your voice is a little cutting, Gayatri.
am I better now? Is it?
Oh, you are so much better now.
Yes, yes, yes. Um, so the first small clarification that I have is how many attempts can we possibly give for each step in the USMLE?
How many attempts did you ask?
Yeah, yeah.
Okay. So the practical, realistic answer that I want you to think is 0 beyond the one that you give. Okay. Technically, there is this facility of, if you fail your exam, which is very difficult to fail, you can give your exam another time after 7 years. That defeats your year of graduation. That gives you a red flag that you have reattempted. So technically, you kill your chances. So I don't want you to think that you can ever reattempt your step 1, step 2, step 3. The good part is, before giving your step, there are a lot of practice tests, like self-assessment tests, like U World and NBMEs. They are very, very realistically accurate. So you will know what you are scoring, and that is only when you will give your exam, right? So I think that answers your question.
And another one about step 3, you said it's better to give the step 3. So is it like an optional thing, or I didn't really catch that?
Okay. So how it works? So US step 3 is basically your license to practice in the US, okay, for whatever you're doing. So you don't need it to get into the residency program, which might be 3-4 years, but you need to give it hopefully within the first 2 years of your residency, before you like have completed your residency to start practicing as a neurologist in US, right? But if you like, just imagine yourself being a program director, right? Am I audible?
Yeah, now.
Yeah, now you are.
Okay. So someone who's also given his step 3, I would like to think in my head, okay, now this resident doesn't have to take his time off to prepare for an exam. I will rather prefer him or her if all of them are equal on step 1, step 2, right? So as IMGs, I think we need to do everything a little extra, which is okay, teaches us a lot of things, but that is the logic behind the step 3 thing.
And what are the alternatives to get hands-on experience? Because to get any hands-on experience in US during our college years is very difficult. So what is the
So during your college years, if you get an experience, hands-on experience, called a clerkship. If you get it after your college, it's called an externship. Both of them qualify as US clinical experience. The only issue is the externships are offered by a lot lesser places, universities. But the paid third-party organizations like USCE Brooklyn or USMLE Sarthi or AMO rotations are not sponsoring anyone. Disclosure, but those are the ones that I have heard of. You can check their websites, look for neurology experiences, and then ask people who specifically had their neurology experience from their place, because that is the best idea. If that is just a place which is collecting money and not offering a lot of experience, or it's a really good experience, right? But there are really good experiences that are paid. So don't worry that you will not get any US is a country which is capitalistic. They saw an opportunity that Indian students want to come and they're not getting clinical experience. They started making these third party companies. So good for us, good for them, but there is no negative to it. Obviously, if you get a clinical experience in a university, it's better, but if not, and then it's okay, it's fine.
Thank you.
Thank you, Gayatri, all the best. Okay, Vaishnav, do we have you? Okay, I'll just answer. Is rotations a good reason to apply for emergency visa, considering getting a B1 B2 is almost impossible? Yes, bro. I mean, that was my story and a lot of people's story. We did apply a B1 B2 visa. My situation was crazy, crazy as crazy. If I tell you guys, you'll be super inspired to never give up in life. But yes, it's a good enough reason. I got my emergency request denied 2 times, which I could not then go to US before 2025. But then I found a way, didn't give up, and again applied through an emergency through a new visa, got how the system works, and then managed to get my emergency visa within a week, went to US within 14 days. So that's a beautifully good reason. All you need is an invitation letter from the company or the rotation that, oh, there's a reason. That is the proof that you're going to attach, right? Okay, next, can we have Bani?
Hi.
Hi Bani, how are you?
I'm fine. Good morning. I wanted to ask that can I go for rotations during my internship?
Yes, you can absolutely go for rotations during your internship, because the good thing in India is that internship is a part of your medical school, right? So you can go for a clerkship also. That will help you with both things, that your year of graduation will not be uh, lengthened. You will have an idea about how things work, but you have to consider the point that you are extending your internship. You will have to come back and give it time, right? And how much your college is conducive to allow you to study. So what I did was, like, I we have a 12-month internship, right? So I did my 11 months, and stopped it 1 week before, and then I prepared for my exams a little. I had a family wedding. I went to US actually later, but then I completed my 1 week internship after a year. So that's a good idea, because that helps me with my year of graduation a little, at least by 1 year, right? So I mean, like I said, there is no one correct way. If some people are super confident, they want to go to US, and they're like, let me just get done with my steps 1 2 and then I will go. Some people are like, I like it, but I'm not sure if how much I will like it. So to them I recommend, why don't you have a clinical experience first? Go, and sometimes you're super sure, oh, this is the life I want, or this is not the life I want, so that you don't start wasting your time, money, everything. So like, again, someone had asked, third year is absolutely fine, fourth year is absolutely fine. After internship, frankly, personally, I think is the best time, during internship, after internship, because by then I think a major part of the knowledge as a doctor you have has been consolidated after fourth year, which is, I think, equally traumatizing for all of us, when they throw all the subjects at us. That makes us a lot better doctors, prepared to tackle situations. So for sure, it's a good uh, option.
Thank you, doctor.
You're welcome. All the very best. Okay, so do we have Shri Rag? Is it?
Yes, Sri Rag actually.
Hi, Sri Rag. How are you?
I'm good. Good morning. It was a very good presentation. And I don't know, coincidentally, a few days back, I have checked your LinkedIn profile and I have seen the post about the step 1 and step 2, and I was inspired. Okay. So yeah, thank you so much. It was so coincidence, I would say.
So kind.
And yeah, so I have few questions. So I am done with my step 1, and I'm currently looking for observerships and externships. And before going to the third parties, I thought about doing checking out or pursuing by myself by mailing the professors and doctors. So my first question is, whom should I mail to? I have started mailing to the program directors. Should I go for the professors too, or doctors, or all of these professionals?
Okay. So again, the good and the bad thing about US, there is no one system. Uh, and I think my trick to suggest people is, just imagine, after a few years, you are yourself as a program director, or in a program, or a doctor, or a assistant, or a staff. Now everyone does have some power. If you if you are someone who's super busy, might even not even check the mail. You might also be that, oh, this is some stranger from India, I can't really help, I don't have time to reply. Okay. You might someone be, oh, I was in the same situation 5 years ago, let me help him if I can. And then again, depends upon my power. If I'm an assistant professor, I can convey it to the PD. If I'm the PD myself, I can directly call you, choose you, right? So your investment in mailing a program director is much more probable that it will lead to an interview, if at all, or an elective. To lesser doctors, lesser so, but sometimes you never know. Sometimes in US, a lot of Safarish works. Like, a lot of residents are asked, do you have someone who you want to recommend to? So if you are choosing the route of mailing it to people, and especially at this time when it is so rare, I would suggest mail as many people as you can without stressing yourself. Right? There is no, what is the harm? What is the harm? There's no harm. Just write a very professional mail and let's see if things work out. But also ask your friends if they're getting like I tell people to study, but not to study, like, but to smart study. So just don't mail everyone. Mail logically, in a way where you think your options are higher, right? So like, if some friend went in somewhere, he can have a chat that, oh, someone wants to come, he's a really good student. So the word of mouth travels really fast. If you have some contacts in US, ask them, seniors. I think rather than, so it's you need to do both the things together. Randomly mail people, check your own luck on that, but also use your contacts. And trust me, a lot of people here will say that we don't have contacts, we don't know anything. Even I don't, no one does in the form we need. Very few people do. But contacts means just getting to know people, getting through your networks. In the sense, I do suggest people to like take one paid and go in US and then help build your contacts, right? Now even that is making contacts, even that is networking. So you can be smart that way as well. Like, oh, I did one paid, now let me search for free electives within US now, which is a real possibility. For medicine it is much easier because medicine is everywhere. Neurology, it's a relatively tougher thing, but again, you are much easier than a radiology elective. So it's, grass can be greener on the other side, but it is green enough on your side if someone else is looking, right? So
Yeah, I have, while I was searching for externships as well as observerships, I came through a clinic who were kind enough to offer me and offered me a chance to do externship in their clinic. So should I pursue it? Some people say that clinics are not as good as universities. Now, from my current experience, that universities are not even, I don't, they are too busy in checking out my mails, or they're reluctant to give. Should I just pursue clinics and that from that to develop contacts?
Absolutely. See, now if again the same logic, if I was a program director, I would rather not have someone do 3 university things. I was like, this guy has no clinical experience, no clinic experience. I personally did one inpatient, one outpatient, which is a clinic, and one both inpatient and outpatient, because that reflects a much more holistic personality for me, right? Oh, he knows this also, he knows this also. Like, again, these are things in my head, but a program director is as human as you are. That is how things work. And similarly, okay, now I did one telerotation as well because I did not have a visa then. So technically, by all laws and logic, telerotation should be the last thing. I shouldn't even care about it because now I have 3 clinical experiences, right? It should be like, I shouldn't even count it. But again, I think depends on how you sell it. In this time and era, I'm like, I've done my hands-on, I've done my clinical, I've done my outpatient, I've done my inpatient. Now I also have a telerotation experience, because you might have a teleclinic as well, right? I know how to do that as well. So I can talk to patients over a tele, and I have 1 month experience for that. So everything depends on how you sell yourself. Rather than thinking, oh, this is a waste of time, start thinking how much you learned and how do you sell it. Obviously be smart enough that, okay, now I've compensated the tele with 3 actual hands-on experiences, right? So even if someone thinks like that, I've covered him, plus I've covered extra people. So I think that's a good way of staying confident and actually making it.
Okay. Okay, thank you, that was so insightful. Thank you so much, have a nice day.
All the best, Rick. Okay, now we have one more person, Vinay.
Yes, am I audible?
Yeah, you're perfectly audible.
Yeah. Yeah, thanks for that brilliant talk. It was really inspiring. So, I myself, I'm a neurology aspirant. I took the decision about 6 months ago. So initially, I was thinking of neurosurgery, and now all my research work somehow got directed towards neurology. I'm a neuroscience enthusiast. So my question, I had a couple of questions actually. So since you said that the years of graduation is somewhat okay for like 1 to 1.5 years, so I was actually thinking of pursuing a neuroscience degree, an MSc or a PhD, which is either a 3 year or probably even 4 to 5 years of a course. So, would that be seen as a red flag for some program directors, or
Okay.
I don't want your opinion.
You are doing a neurosciences degree, right? As of now.
No. Right now, an MBBS I'm in MBBS third year. I just want to know whether I should opt for it or not.
Like in India, you mean in India, right?
Right.
Or outside? Okay. So now, if you are at this stage, I would say, if you're sure you want to be a neurologist in US, I would say go the usual path, apply for it, do your steps, and go be a fresh graduate. Now, if you do a neurosciences degree, that beautifully justifies your gap. There is no technical gap in the sense that you've been pursuing your dream, you've not taken a break. So it does add that you have additional knowledge that goes as a plus for a neurology program. But then there is a negative side to it, that you have your year of graduation is 3 to 5 years older now. Okay, so now it's a balance of two things. The safer, more conventional path is what most people do, right? But again, if you're passionate enough and there's a real reason you want to do that neurosciences thing at here, and you can justify it in your interviews and talk about it, it's super amazing. But you know what, the only issue that will happen, there might be certain programs which filter your application based on your year of graduation. So they will never know that you were involved in a 5-year program. They will just filter it out. They will not even read your application. If it is read, and if someone sees, okay, he has an older, and now they say they have an older year of graduation, now they will check what was he doing. Now it is okay, now you are in the race. But you understand, you were out of the race for so many people who never checked your CV. Okay, so that is the risk you are willing to take. And rather, if a possibility arises, like there's a lot of postgraduates similarly in India who later apply for USMLE, right? So it's not that they don't match, right? But especially for a PG, because their PG becomes irrelevant in the sense that it doesn't add to their years there, but it does help them that they know that you have had some clinical experience, and especially if it is in the same field that you're applying for. But the risk benefit ratio is something that needs to be calculated. So if you ask me for an advice, that would be the advice: go the conventional safer path, especially an IMG. But if it is impossible, or if it is, what are my views on it, I think I gave you an idea about it.
All right, thanks. And my other question was, so like, is it, I mean, I don't know if it's a myth, but is it like possible for an IMG to match into an Ivy League university? People say applying as a research, like even a postdoc or an assistant or an associate there, and probably work there for like a couple of years will increase your chances. So I want to know your opinion on this.
Okay, so one, there are two kinds of things. You know what an Ivy League is, but for other people, I'll tell. Ivy League are a set of prestigious colleges on the east coast of US. So it's more of a legacy kind of a thing. Okay, so those 9 colleges can be very different from each other in terms of how they operate, but they're all Ivy League. Okay, so there can be other good universities which are really hard to get but aren't Ivy League. Okay, so now there are universities which, like Mayo, no matter what you do, they want a 2, 3, 4 year research experience from Mayo only. So if I'm not willing to give it before my applying there, I don't expect myself to get matched there, right? In Mayo and other certain Ivy League colleges, because they expect a research experience, be it an IMG or an American graduate. An IMG more so, because then your probability is even lesser. How much are you willing to do that? Okay. But there are certain places which see other things, which don't just see crazy research experience, which see decent research experience, which might be an Ivy League, which might not, more so will not be an Ivy League, but they're really hard, difficult universities that will not offer an interview to anyone else just because of they don't have research, or they have to have something else in their CV. Now, you have to individually research these programs if they want research or if they want just a crazy amazing CV. If you don't have a really good CV, and if you don't have a research, then I would say 99% not an Ivy League for sure, and not even a good college in the sense where you want to go. The good thing about neurology is, because it's a very educative, teachable subject, most good programs are anyways university based programs, right? But again, there are hierarchies to that. Every state university, and then Ivy Leagues, and then crazy good private universities. So it's not impossible for sure, but improbable highly without research. But again, your research doesn't need to be generalized to all Ivy League. You should ask yourself which Ivy League, and then you will have a better answer to that.
Okay, thanks a lot.
All the best, Vinay. Okay, before I move on to the last part of the session, anyone who wants to ask any question can turn on their camera, have a one-to-one beautiful question and answer. Feel free. Short questions. Mihir, yes, go ahead.
Hello, Abhisar. I'm quite inspired by your action. I'm really happy. I wanted to ask that for clinical electives, I'm basically a final year medical student, and I'm planning to go for electives next year in my internship. But I'm not sure that when should I go for it. Is it should in the start of internship, at the mid of internship, or at the end? The general idea is that for electives. My doubts are that should I prepare for step 2 and have a good knowledge base of the medicine and every subject, and then go for clinicals, because personally we don't have much clinical experience in our college.
So let me try answer that for you. Like I said, there is no one correct way, but there are definitely better ways. There are definitely wrong ways. You get it? There might not be one correct way, but there are wrong ways to do things. So like I did have someone who at one time, if you guys remember, there used to be step 2 CK and CS. Right? So CS used to be you had to go to US and simulate your over patients, and like that guy was my senior, and he very much prepared for his step 2 CS. He was like, step 1, step 2 I will be able to give, let me just get over with CS first. The day he gave CS got cancelled. So go step by step, right? Don't go into uncharted territory, because don't take the risks. But for me, if the same logic, if you have time and you are not currently studying for step 1 and you want to be sure if you want to go to US,
I have done step 1. Okay.
If you're not doing step 2,
yeah,
so you can, if like sometimes like you could be someone like, I just gave step 1, I need some break, I'm not studying for some time, let me try for an elective. If you, and again that the picture question comes into picture, if you already have a US visa, makes things a lot easier. If not, that is also going to have certain time that needs to be consumed. For someone like me, I had this question mark that will I be able to get a visa immediately, and then it was like, okay, let me just give my steps together so that if I don't get a visa, I shouldn't be demotivated in the moment. So that worked for me. That okay, I gave my step 2, I got a really high score, I got a 259 on step, or 261 on step 2, and I was like even more confident that okay, now let me see how things work out. Right now, if I'm an immigration officer, and by chance that immigration officer knew about what steps are, and he got to know that I got a 261, he was like, please, like he opened the door for me and please enter. So you never know what things work out in your favor. You need to be very confident. But so either way, I'm telling you, is not a wrong way. Both is fine. But just make the best use of your time is the advice I want to give. Plan it so that neither time is wasted. If you plan like, I don't want to study for step 2 for the next 3-4 months anyway, then sure. Also, you can do another thing. A lot of people do they go to US for electives and they start studying for step 2 simultaneously, and they give their US step 2 exam there. But I was someone who wanted to study very nicely at home, so I didn't choose that. Again, you have to know what works for you, right?
And my second question was, since the step 1 has changed from the previous mark status, currently what are the other requirements apart from electives, which I should do, like apart from research paper also?
What you should do, like what other things you should do?
Yeah, what are the things?
Again, like your CV needs to scream neuro. I would say that's the best thing. Do something neuro, attend conferences, do workshops, try contributing to research papers in different ways, be it clinical case presentations, go to conferences, because the truth is now step 1 is pass fail, right? And make sure you get a good step to score. That prioritized over everything else. Other things I'll tell you to focus much more if you had given your step 2 already, because now it is done. But now you still have your step 2. Give it time, give your best shot at step 2.
Thank you.
All the best.
Thank you.
What I'll try to do is I'll share a link for my YouTube video on step 1 for everyone, including you. The reason is there's a lot of overlaps with step 2 as well, so that can help everyone as much. Akshita, just remind me, I'll do that towards the end for sure.
Yes sir.
Okay. Gurleen had raised her hand. Gurleen, do we have you?
Yes sir.
Hi Gurleen.
Hello sir.
How are you?
Good afternoon. I am also from GMC Amritsar. I'm really glad to meet you here and connect with you. Actually, I had a question, like I'm in the second prof and it's just about to end. And in these 2 years, I haven't started any preparation for the steps or started like that. but I now really want to do my PG in USA or Canada and start my preparation. So like I'm really confused from where to start to prepare for steps, what resources should I use, and how to participate in which things I should participate, conferences, which type of programs, or where can I volunteer, where can I find these opportunities, like in nearby in Punjab, or where I can do hands-on, where I can go actually, not virtual. So
For
I'm
US.
really, yeah.
Okay. For the you want in short, like where can you find opportunities for doing US clinical experience, right?
Yeah.
Okay. So first of all, it is never too late to decide. You
Yes.
are too beautifully young and you have all the time. So just want it enough and you'll be able to do it. That's a good thing if you want to be sure if you want to do US. It's a good plan to go to US for clinical experience. But in all honesty, it's getting a university program would be difficult unless you have contacts in US because you don't have your step scores, right? And you don't plan to have it right away. And the good thing is we have a lot of paid clinical electives for them, which don't require you to have your step scores, right? So if that sounds a good option to you, you can try USEE Brooklyn. You can try USMLE Sarthi. There's this Jackson Park Hospital in Chicago. I recommend it for neurology. I don't recommend it as much for medicine. So again, you can explore the net. You can follow a lot of webinars that happen through organizations. AMSA, I say AMSA because like I was a huge part of it at one time, but MSAI and other organizations that are currently active. And I think the best thing that you're doing right now is, if you are interested in neurology, I think GNA is doing such an amazing job collabing with so many places. So just keep your eyes open and you'll find things for sure. Like even right away, you can go to USC Brooklyn or any of these organizations because they have their Instagram pages. They want you as much or even more than you want them, right? So explore it, check out their pages, ask all your questions. Don't be hesitant. Like ask questions. Like don't be afraid. Like there's this part of Indian mentality that we don't ask, or we ask other people that please ask what is happening. Like start being that person who is mailing people nonchalantly. Like you have to know what is in your benefit, right? Ask all the information. And I to even recommend, like, be the one, like if people don't help you, be the one who helps other people, because that is how changes are going to come in the society, right? What am I going to do with all the knowledge that I have gathered? What am I going to do with all the mistakes that I have done? I try tell it to as many people, so that you do different mistakes. You don't do the same mistakes, and you tell those mistakes to someone else, right? And although I'm still in my journey, so technically I still need a lot of things to go in way. But the reason that I do try be a part of these sessions is because things are fresh in my head to help people. With time I'm going to forget certain things, so it's important that I tell as many things freshly to all of you, right? So all the best, Gurleen.
Thank you, sir. And I had another question also. Like my parents are in Canada, so most probably I'll be going to Canada next year for a month, and maybe I'll have an observership there in their hospital. So will that help in any way in US while I'm applying?
Okay, again, same logic. If I'm a program director in US, if you tell me you have US clinical experience in India, doesn't count as much because it's very different from US. If you say you have in Canada, very similar to my setup. So yes, you do have some experience. So there's a joke that goes around, like Canada is not Canada. Canada is America light. So it's pretty much America. No issues.
Yes.
So but again, if you ask better than a US clinical experience, no. But if you're anyways going to Canada, you have some time, why not? Like, why not? Is should be the question.
Yes.
Yeah.
Yes, sir. And also, which books or resources should I start with if I want to start my preparation for step 1 now and give it at the starting of my 4th year? Like
Thank you
what
for
should?
asking that question, Gurleen. I have just the link for you that I shared in my chat. If you're starting your step 1, here's the link to the YouTube video that I have, that I very wholeheartedly created for all of you. It says 10 things USMLE step 1 that no one tells you about, but you should absolutely know. So I think that will answer your questions. But to answer it in brief, very few resources: first aid, Boards and Beyond is beautiful, Pathoma, and UWorld. But you'll get all of it in this video, how to go about it. And similarly, people doing step 2, there are certain tips that can help you with step 2 as well. I plan to make a neurology and a step 2 video and a step 3 video, but I don't think that is going to happen until I get your wishes and I go to US. After that, for sure, but I'm sure that use this link, and I think everything else GNA will keep you in check.
Okay, thank you so much, sir.
All the best.
Thank you.
Okay, now before before I go to Tanishi, I hope you're ready. I would also request everyone, if you happen to watch this video at any time, I would love you guys to comment, because I need your reviews so that I can improve and other people can improve as well about how you like the video, if you want anything else to happen in the video. So please go through, watch it. It's a short video, it will help you. And if you like other things, I've made a video on psychiatry, how to study psychiatry, because that's important. Step 1 and step 2, you can check that out. But let's move on to, I think the last question for the moment is Tanishi.
Hello, good afternoon, sir.
Hi, Tanishi, how are you?
Thank you so much for this amazing session. I'm actually a second year student, and I was wondering how I could proceed with neurology based research at my level.
Neurology based research.
Yes.
Okay. So again, this how things go is you mail a lot of places, but the better part is a lot of more places will reply. One place I specifically know is Mayo, Florida, Jacksonville. I did get a research opportunity there. Unfortunately, I had other plans, so I could not continue with them. But that is one place that does offer, and you're in a good spot because you have time. Like you can give them time. Like even if it is next year, you can start approaching them right now. But besides that, like that is just one place. You can get this opportunity at a lot of places. Start mailing them that I'm this person. Send them your CV, whatever you've done. That I'm enthusiastic about research, especially in neurology. But at the same time, what happens is a lot of people searching for research opportunities don't get the option of what subject they want to do it in, right? In US. So it's okay if you say that I would prefer it, but it's okay in whatever you give. Gradually you make your contacts, but the research works that you do in India in the next upcoming years, because that don't take a lot of time, that is on your will. Try those topics to be on neurology, right? Because that will help you build your CV. Like if I did my first clinical case presentation was from a case in GMC Amritsar only, was progressive multifocal leukoencephalopathy. So it was like, it screams neurology, and it's like it felt right to me. So similarly, start when you have a choice, prefer neurology. When you don't have a choice, grab the opportunity, is my advice to you.
Yes, sir. Thank you so much, sir.
All the very best. Okay, so guys, I'm going to move to the last session, which is a little poem that I have for you guys and a little message. But before that, I want to ask everyone to be ready. If you guys like the poem and if you like this session, I would love you guys to turn on the camera by the end of the poem so that we can have a photo together with Anushri as well. Anushri, is that Anu? Anuradha, is that okay? Sorry, I mispronounced your name. Anu.
Yeah, of course. No worries about it.
Perfect. Okay. So, Anu, are we missing out on anything, or are we good with the session? Then let's just move on to the last session.
I think we're good. We can see if there's any other questions after the poem.
Oh, sounds good. Sounds good. Okay, then I'll just move on to the last part. Okay. There's so many tabs on my laptop, as you can see. Not super organized. Just 1 minute, guys. Let me just organize. Guys, feel free to drop in any questions. I'll take it, and then we can wrap up the session by then. Anu, is it okay if the screen is not sharing? I can just like recite it, because otherwise it'll take.
Yes, sir.
Yeah, of course, of course.
Good. Okay, then now we can look at people who can start turning on their videos as soon as they like the poem. Sounds good. Okay, so Akshita, let's start with you. Can you turn on your video? I don't want to.
Yes, sir.
I feel a little conscious if I'm talking to myself. Okay, so we'll be waiting for everyone, and by the end of the poem, we hope that people start turning on their videos. Okay, if they like it. And this poem is supposed to tell a very important message in two ways, both in your USMLE journey and in life as doctors itself. The first part is that as doctors, what happens sometimes, like we did have a autistic patient, which we now call as people with autism, and it came to our department, and all of us had this spark in our eyes when we started seeing that patient, that we had certain questions, or we'll be seeing this case for the very first time, and in the moment we forgot that it's a patient, it's a human being. The mother of that child is still very much human, as if anyone of us would be. So this poem was meant to connect my love for neurology and my skills, and it is titled it's actually the story of an autistic kid that I think in my head would be my kid, called Otto. Okay, so ready. It's called Atypical Minds in a Stereotypical World. Otto didn't look at his mommy the same way other children did. Otto didn't peek-a-boo every time his daddy hid. And every time I tried to touch him to comfort, it turned out to be a terrible accident. With time, I realized Otto was unique. Focused on self needs, his desires were concrete. He flapped and rocked and twiddled and knocked every time the emotions were a little too much. And when I took him to a doctor, as human as you and me, he told my boy was autistic. There wasn't a cure as such. Fixated to routines, Otto fidgeted with his toy trains, restricted speech, and intelligence not at par with normal brains. But in a world with a billion people and skins of every hue, who decides how you choose to define the IQ? In a world where every parent wishes their child to possess a unique skill, why does only a boy with a neurodivergent prophecy pay the bill? A development pervasively disordered. That's how genius men decided this condition shall thereafter be honored. They profess, and I accept. Autism is a spectrum, not all brains are born the same. But my soul disagrees when they call it yet another diseased mind game. The management, they say, is supportive, collaborative behavioral modification sprinkled with hints of metacognition. Heavy words, and there still isn't a cure. Heavy words, and there still isn't a cure. But is autism even a disease? Are we really, really sure? A brain that's wired different is not necessarily a mind that's diseased. Atypical minds in a stereotypical world, they would rather be. Only if we could change how being normal was perceived, So that's something that I believe I can't only take the credit for, because sometimes some words are just coming through your hand as a medium. The only thing that is required is for you to be observant and try connect what you've seen and your love for neurology, because I think the reason that we've chosen to be doctors is not just to make money. It's a beautifully mesmerizing profession which helps you live your life, earn for yourself, and at the same time serve the society. I think your work is charity. What can be more beautiful? You don't have to go out of home to do charity, right? And the other reason I wanted to tell you, I've conveyed this poem, and this is a shorter version of the poem. This poem is 3 times longer. So I didn't want to take anyone's time, but this poem was something that I wrote in my personal statement on the second page. And it was a very, very difficult decision, because in your personal statement is something you send to every program director to showcase what kind of a person you are, why neurology, what you are, everything that is not in your CV. And it has become a trend for it to be very safe, very grammatically correct, very paragraphed, very phrased, to showcase, oh, that you are a very conventional, decent candidate. But to me, like I've been professing throughout, you have to know what works for you, what seems fine to you. And it just didn't feel fine for me to write that I write medical poetry. It felt right to me that if someone reads this, maybe he knows better how passionate I feel for neurology. And I went against a lot of people, and I realized during my interviews that a lot of people so much liked it, because at the end of the day, everyone's a human. They are neurologists finding neurological passions out there. So you need to make the hard call for yourself and just go with your gut, what feels right to you, be it any little piece, be it writing a poem in your personal statement, be it doing an MPH for getting into US, be it not doing anything. Justify in your head to yourself what you are doing, why you're doing. And trust me, when you get the opportunity to pay it back to people in your life, you will be a much better human helping other people. And like I still find people during my interview process who are like that we were in love with your application, and then there are people who never say anything. So you will find people like you. Just allow yourself to feel those emotions and know yourself, right? So I'm glad. I think a lot of people did like it. We have a lot of cameras on. Akshita, Anu, good job.
Thank you,
I
sir.
I think we can definitely have one photo together if anyone can click it.
I'll click the screenshot.
Perfect. Let me start by saying something that I very, very wholeheartedly believe since the day I fell for neurology. That no disrespect to any other subjects, but we know a lot about every little thing that happens in our body from a scientific point of view. We know an ocean about neurons, but not even a drop about the millions of them coming together and emerging as brains. So I think brain is still one of those organs that holds so much mystery and so much potential to honor, to answer such great questions about life, philosophy, and science in general. So I think one thing that I and any other neurologist would really connect to would be your passion towards neurology as such, because I don't think that is something that can be created. So if you're passionate towards brains, towards neurology, I think this is the most beautiful thing that we can ever do.